Got to talk about this. Quarantines, testing, contact tracing, airport screenings. Does all this sound very familiar? Unfortunately, don't worry. It is not 2020 again. It's not COVID. But this is serious. There is a different virus outbreak in India that is triggering all of those familiar precautions in parts of Asia right now. It is called the Nipah virus, okay? And it's often deadly, has a fatality rate of 40 to 75%. There are only 2 cases of the virus in India so far, but it has prompted airports in Thailand, Singapore, Hong Kong, Malaysia to step up their screenings to prevent a bigger outbreak. And the virus is carried by bats and pigs, but it can be spread human-human contact. But how easy is it to be transmitted? What's the incubation period? How worried should we be? I'm joined right now by an infectious disease epidemiologist at the Harvard Belfer Center, Dr. Syra Madad. Thank you so much for taking the time. Really appreciate it. What exactly is the Nipah virus?
Well, the Nipah virus is a serious virus, and as you've mentioned, it does have a high case fatality rate, anywhere from 40 to 70%, and that also depends on where you're getting healthcare services. So if you're in a country that has good a healthcare delivery system, you could probably get much better care, and that case fatality rate is likely much lower. Now, with that said, as I mentioned, it is a serious virus. It has no approved vaccines or therapeutics, but in this context, it is a small and contained outbreak, and it is closely being monitored. And so when we look at these 2 cases that have been confirmed in India, in West Bengal, about 200 contacts have been identified, tested, and are negative. And at this time, no additional cases have been detected, as well as there's no evidence of spread outside of India. While you've noted, a couple of countries have started to implement enhanced airport screening, that's more of a sign of a precautionary step than to signal a wider spread of transmission. So this is just precautionary.
My concern is whether or not that would actually work. I read that it has a 2-week incubation period. Sometimes symptoms might not even show. This can be spread human-human contact, but it's different than COVID, right?
It's very different than COVID. So when we talk about COVID-19, we think of, airborne spread. And with Nipah virus, it is not like that. It doesn't spread through kind of the airborne route. There are 3 ways of transmission. And so when we talk about the 3 ways of transmission, one is from animals to humans. That is what oftentimes, starts. That is what starts the outbreak. And so coming in contact with an infected animal, such as a bat, or through the foodborne route, meaning that an infected animal has contaminated food products like fruit or even a date palm sap, and then a human consumes that and then gets infected. And then the 3rd way is human-to-human transmission. And through human-to-human transmission, that is close, prolonged contact. So oftentimes we see that in household settings or in healthcare settings where infection prevention and control is not as great.
So in other words, and correct me if I'm wrong, it could be transmitted maybe like the norovirus. So it's not, you have to have prolonged contact with somebody. Is it somebody who's showing symptoms? Because again, the question is going to be, what do people do to prevent this? What are ways that they should avoid it?
Yeah, it's an excellent question. And what's important is because it doesn't spread, as easily through the airborne route like measles and COVID, it is more difficult to get it. But it obviously, you can still get infected if you're in close contact with, any infected animal sources, bodily fluid that's infected, or infected food sources. So with that, prevention really is to avoid these contaminated sources. When we talk about the incubation period, it is anywhere from 4 to 14 days. So when somebody is symptomatic and you see them visibly sick, it's the basic precautions. If you see somebody that is sick, you want to make sure you're keeping a distance from them. And especially if you're in that local area where this outbreak is happening, you want to be even extra cautious. But in other countries, for example, regional spread, it's still very low. And, you're seeing these airports, these countries doing enhanced airport monitoring as a precaution. But in terms of spread more internationally, for example, to the United States, that threat is quite low, but it's always good to be prepared.
And by the way, just to reiterate this, what are the symptoms exactly that you should be on the lookout for? And you mentioned there's no established therapeutics or vaccines yet. If you get it, how do you treat it? So 2 questions. What are the symptoms and how do you treat it?
Yeah. So the symptoms, the initial symptoms could be fever, cough, sore throat, and then it can progress to pneumonia or even neurological conditions. It can cause brain swelling and the like. And so it could be pretty rapid sometimes. And then in terms of, the treatments, there is no treatments or vaccines available. So it's really supportive care. So in the hospital, getting supportive care like intensive care support and the like. And we do have some investigational therapeutics, but nothing that's approved.
All right. I hope this is the end of the conversation. Hopefully it is contained. Dr. Madad, thank you so much for taking the time to explain it to us, because I don't know if a lot of people know what's going on out east, and I appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.